I'm Josh Stein, candidate for State Senate. We must expand access to affordable health care to everyone. North Carolina must find ways to control health care costs, improve quality, and fix our broken mental health care system. 1 out of every 6 people in our state doesn't have health insurance. That's nearly 1.5 million people. In Wake County alone, nearly 70,000 of our neighbors have no health care coverage at all, including thousands of children. It is unacceptable that North Carolina has children without health care coverage. As your state senator, I will fight to change that. Every child should have health care insurance so that no parent hesitates to take a sick child to the doctor. Our challenge, and one I'm prepared to tackle, is the explosive increase in health care costs. Health care inflation has gone up by double digits, much greater than the inflation rate, and certainly more than our wage increases. This is no way to go. But even those fortunate enough to have health care coverage worry every year how much our bills are going to increase, how much more in co-pays, premiums, and deductibles will we face, and at the same time, how our benefits are going to shrink. Our greatest fear, we'll lose our coverage altogether. Health care costs must be controlled. We must prioritize preventive care, primary care, and disease management. It's more cost-effective and better for health to prevent obesity than to treat diabetes, for instance. A visit to the emergency room costs 10 times more than a visit to a primary care doctor. We should promote evidence-based medicine to ensure that our healthcare dollars are wisely spent and not wasted on treatments that don't help or, worse, harm the patient. We can control costs and improve quality at the same time. The governor recently appointed me to a panel to ensure that hospitals report infection rates properly. Once hospitals report statistics in the same way, we'll know how they're performing, and we can focus on improving their quality of care and reducing unnecessary deaths and disease. Just as critical to physical health care is vital mental health care services. The deterioration of our mental health care system, with its move toward privatization and away from local solutions, is nothing short of a tragedy. News accounts estimate the amount of waste in the new system at $400 million. The legislature must fix the mess it created, and the state must take responsibility for the decline in mental health care. The patients and their families deserve no less. Health care challenges strike its victims when they are least able to fight back, when they're sick or in need of surgery. As your state senator, I will fight to make sure common sense preventive care is available and affordable, and that insurers and healthcare providers treat patients fairly. With my track record taking on powerful interests and winning, I am ready to get to work, and I ask for your vote.